to tie this back on. And I want to make sure that it's not tied too tight. And how we measure that is we do 2 finger widths between the neck and the ties of the patient. Next, I want to place the gauze back under the patient. Now let's go over what happens if the patient has an irritated neck before we finish this. I would want to place the ointment on the patient for the infection before we finish putting the gauze back on. Okay, now the patient is done. We want to make sure this stays flat, because if this is crinkled up under the patient's neck, it could cause irritation or even other infections. I'm going to check the heart rate, blood pressure. I will check the end tidal CO2, and I also want to check the patient's breath sounds bilaterally, if anything moved. If I suspect something moved too much, I will also want to order a chest x-ray on the patient. Now that I'm done, I can discard of all the materials that I use for the patient appropriately. Okay.
Identify how frequently trach care should be performed.
Trach care should be performed every shift or as needed. If we see that the trach is dirty, we need to perform trach care.
Describe how to adapt a manual resuscitator to fit a metal trach.
We will use the right adapter that goes with the metal trach. If we don't have the right adapter,